Welcome everyone to our Fireside chat hosted by the Access to Medicine Foundation. My name is Natalia Sánchez. I am a researcher at the Foundation's Generic and Biosimilar Medicines program. And our topic today is innovative pathways, ensuring availability of essential medicines for all. As we know, around the globe, but especially in many low and middle income countries, millions of people are struggling every day to access essential medicines. And even when medicines such as generic ones may provide more affordable options, access to these is often not guaranteed due to insecurity across the supply chain. Lack of visibility about the needs of the population and inadequate local distribution channels are some examples of issues that can make it difficult for people to access essential medicines. So in today's conversation, we will hear more about practical actions and strategies being employed to improve the availability of essential medicines and make sure that every person has access to the treatments that they need when they need them. I want to welcome our speakers and participants today, as well as those tuning in the conversation. So welcome Gifty, Stephanie, and Harm. And I may want to hear a bit of an introduction from each of you. We may start with Gifty, then move to Stephanie, and then to Harm. Thank you.
Thank you, and a good day to you all. My name is Gifty Sunkwa-Mills, and I'm a medical doctor specialized in public health. I'm based in Ghana. I have worked for several years in the public health sector and also with organizations such as the World Health Organization over the years. Currently, I work with PharmAccess, which is an international non-for-profit organization that is focused on connecting more people to better health through the power of digital innovations. I work in PharmAccess as operations manager and research lead in Ghana, and I'm in charge of program support for various programs, including Med for All, which I'll be talking about today, and also Safe Care, Innovative Care, and Medical Credit Fund. Thank you.
Hi, good afternoon, everyone. I'm Dr. Stephanie Oluyide. I'm a medical doctor based in Nigeria, Lagos. I work for an organization called the Africa Resource Center for Excellence in Supply Chain Management, RKSM for short. I'm a manager at RKSM. I currently manage our private sector membership platform, as well as one of our major grants with the Bill and Melinda Gates Foundation, called the SSTS, Strategic Support to Targeted States Project. I was speaking a little bit more later on about the work that I do in both sort of areas, both the platform as well as with the grants. Thank you for having me.
And good afternoon, everybody. Good morning. My name is Veerkamp. I'm working since 3 years for IDA Foundation as the Director for Procurement Services. My history goes back to a study where I studied extension services and business a long time ago, where I actually specialized in adoption diffusion of innovations in agricultural communities in LMIC countries, and also the spread of information systems. And why do I tell this? Because I think it's relevant for the pragmatic approach we have in IDA Foundation. And I'm actually doing the same as I learned at that time, but I do it now in a pharmaceutical context. And then about IDA Foundation, it's a not-for-profit company based in the Netherlands, which has pursued already for 50 years access for medicines and medical supplies for those who need it. And we were one of the pioneers in creating access for generic medicines, for ARVs in the HIV/AIDS setup, and also for TB. And we have done that till today. We see ourselves as a pioneer, really bringing access to medicines for those who need it in remote areas. And once markets has established themselves, our job is considered to be done. We are very much currently collaborating with donors, NGOs, manufacturers, and countries, also around local production in our wholesale businesses, as well as in our procurement services unit. And lately, NCD initiatives have a majority attention in our organization to see how we can solve the puzzle around access to medicines for NCD, for NCDs. Nice to be here and nice to contribute to the discussion about access for medicines to all.
Thank you to the three of you. So to start off our conversation, I want to start with Stephanie. So we know that the supply chain of medicines can be highly fragmented. And sometimes within the supply chain, within different stakeholders, there are a lot of issues to communicate with each other and really know what the demand is, when it is needed, and how can the industry or the private sector respond to the public sector needs. Can you tell us a bit more how the Africa Resource Center, ARCSM, is putting in place this public-private partnership model to help bridge this gap between local manufacturers and procurers in Nigeria?
Awesome. Thank you. Thank you for bringing that up. So just to backtrack a little bit, to give a little background as to who RPSM is, we're a resource platform that basically seeks to provide government with access to expertise, resources, and tools that they require to be able to improve on the existing public health supply chain system. And so our focus really is on the government. How do we help them build the supply chains so that they're more efficient, and ultimately everyone in Nigeria has access to medicines wherever they choose to access care from, so specifically public facilities that are closest to their communities. And so a lot of what we do is really sort of playing that role of broker or middleman, I guess is the word, where we identify the resources in the private sector, and then we sort of bring them to the government to say, these resources are available based on your demand, specific requests that you've made. We think these are the key sort of expertise or tools or resources that we think will help you address the current challenge that you have. And so that's pretty much in a nutshell what we do. So it's bridging that gap or doing that matchmaking. That's a lot of what we do. And so one of the issues that arose, which is something you just touched on, is, and I think Ham had mentioned it earlier as well, but sometimes it's just a challenge in terms of how do government and private sectors speak to each other, and what are the challenges in that relationship? And you know, the biggest issue obviously is trust. There's always a challenge where both parties think that the other person is, you know, not being honest, or you know, private sector thinks public sector is not efficient. Public sector thinks private sector is all about profits, and forgetting that, you know, you have to reach everyone, you know, down to the last mile, regardless of the costs. And so one of the requests that we got at the time when we first started engaging with states in Nigeria. So anyone who knows a little bit about Nigeria knows about, we have 36 plus 1 states. And so we started engaging with the states one-on-one based on the grant that we currently have. And one of the requests that we got from a state was to say, look, we have this, we just set up a drug management agency. So it's basically, if you think of it as a brand new distributor that has no commodities in its warehouse. So it has an empty warehouse, not a lot of money, but we need to start sort of procuring medicines on behalf of the states. Can you help us? What do you have in your platform that you think can help us address this gap? And so, like I mentioned, we're a resource library, we're a platform, and we currently have 3 platforms within the organization. One is a private sector membership platform, which is solely focused on the corporate sector, so corporate organizations. We have one around education and research, and one around individual experts with specific skill sets. And so obviously we went to our private sector membership platform to say, well, we have a group of local manufacturers that were under an umbrella body called the PMG-MAN. The word is a bit of a mouthful, so I'll leave out the full meaning. But PMG-MAN is basically the Association for Local Manufacturers in Nigeria. And we were like, okay, so is there a way we can create a partnership between the local manufacturers and the states, such that the states are able to, I guess, 3 key sort of principles underlie the partnership really. One is around obviously ensuring that we have access to quality and affordable medicines. And so that brings in the angle of, obviously the organizations need to be registered with NAFDAC, which is our, you know, regulatory body in Nigeria, you know, so they need to meet the minimum standards based on NAFDAC for a local manufacturer. Then in terms of affordability, the companies need to sell to the states at distributor price. So that also helps as well in terms of, you know, the markups. And then the next level is around exclusivity. So if you're signing with a company, the state is to say basically that I won't go actively looking for another company that can supply me the exact same medicines I'm already buying from you, because then that sort of takes out of the volume, which is the whole, the name of the game, if I can put it that way. The volume is the key sort of driver, because if a state is buying, you're expecting that they're buying for all of their facilities. And I mean, we have some states in Nigeria with 1,000+ facilities. And so there's the exclusivity clause, and then there's also the last bit, which is timely payments, from the government side, So agreeing to a credit facility, but the credit facility says you need to pay within 4 weeks, within 6 weeks, so ensuring that the government does pay based on the agreed timeline. And so that really is the fundamental, or the key sort of 3 principles behind the partnership. And to date, I think the partnership has been running for about 3 years now. One of the states has been running for 3 years. Some of the other states are, have sort of caught on with time to say, okay, we see what's happening in the state. We also want to buy into this initiative. And so we currently have 6 states. The last state just signed actually on Friday. So that we have a brand new state. And we also have, I mean, they've been able to achieve quite a lot in terms of, states going from having access to 12 SKUs to currently having access to 1,000+ SKUs. Being able to also provide health commodities to their facilities. So maybe we were able to supply only, 10% of the facilities in the state before, and now we have states that are supplying 90+% of the facilities in their state. So addressing that issue of availability, the more facilities you have, these commodities in, the more people have access to the commodities. So I'll pause now. I'm not sure, I'm probably up to 4 minutes. Thank you.
Thank you, Stephanie, for these a lot of important points here about building this pool for availability, about increasing progressively the work with different manufacturers, and this measuring and tracking of this progress, I think, is also a very key point to take into account. Gifty, I want to go to you, because I think a lot of the things that Stephanie has been mentioning must resonate with the work that PharmAccess is doing. Can you tell us a bit about the work that PharmAccess is doing in Ghana, specifically with the Medicines for All, or Med for All platform? Because I see some points coming up in common, especially the work in connecting different stakeholders. Could you tell us a bit more about this?
Absolutely, and thank you, Stephanie. That was insightful, and I see a lot of connections here, because we are also trying to address the gap in procurement and medicine supply in Ghana. And usually what we have out there is a fragmented supply chain platform with a lot of middlemen. So when that happens, then there's a risk of introducing falsified and substandard medicines. And also the prices increase, because at every point, middlemen introduce some additional percentages on top of the original prices. And what we have done with Med for All, now digitalization is permeating almost every sector, and the health sector is catching up very quickly. So in collaboration with the Christian Health Association of Ghana and CHAG, that offers about 30% of the population healthcare, especially those in the underserved areas, we have set up a platform, PharmAccess Med for All platform, together with CHAG. And what we do is to have medicine suppliers and manufacturers who are pre-qualified. Of course, we make sure they are approved by the Food and Drugs Authority, the FDA in Ghana, and then their medicines are also registered with the Food and Drugs Authority. So we get the suppliers to onboard the platform, and then we also have the health facilities directly onboarding the platforms. So just by going onto this platform, you can see what manufacturers and suppliers are there, what medicines they have available, and what prices. And the good thing is that based on the volumes and economies of scale, we are able to negotiate the prices with the suppliers. So by going there, you are going to have medicines which are already about 20% below the market value. And that will enable you to give the medicines, to the facilities at an affordable rate as well. And because of the way the platform is structured, the suppliers are able to group facilities. So we know that maybe there are 3, 4, 5 facilities in an area which is hard to reach, barely motorable. But because we have a large number, we are actually motivated to go all the way there and deliver because it's value for money. And also, we ensure transparency. Before the providers are able to order on the platform, there's a 3-step approach. There is always an initiator, there is always an approver, and there's a payer. So it's not a one-man doing everything, which could, result in, compromise. It's all very transparent. And we also do a lot of capacity building. We engage the facilities, we train them continuously. We take them through inventory management systems so that we don't have the issue with expired drugs and all of that. So it's a win-win approach for the providers, and it's also for the suppliers, and the patients gain because then there's always medicine at the facility. They don't have to incur additional cost for overpriced medicines. And we check the medicines. We have a TrueScan device where we do random checks of the quality of medicines. And we also conduct research to make sure that the medicines quality are top-notch on the platform. So these are some of the approaches that we are collaborating with CHAG to ensure that medicines are made available, affordable, accessible to the patients at the health facility level in the remotest areas in Ghana.
Thank you, Gifty. I think the Med for All initiative has definitely made some strides, especially when reaching rural and hard to get populations through this approach. Harm, I want to go to you. I know digitalization, pool procurement, these are all words that are coming up with IDA's Foundation newest platform. Would you talk us through a bit more about this new platform and how it is going to work?
Yeah, and thanks, Gifty and Stephanie, for your examples, because they develop according very similar lines to what IDA is also doing. And I think we are aiming for the same type of outcomes. And what we have said at IDA is 2 years ago, when we signed our first contract with the Defeat NCD organization, we said we need to look more at the NCD market. So actually our scoping is really about NCD. So it's not about the whole range of essential medicines. But we have said the only way of trying to bring NCD medicines to LMIC countries is by bringing people, organizations and countries together in a digital platform and try to solve that puzzle. So since then, we have started engaging with all kinds of organizations, patients organizations, capability building organizations, but also advocacy organizations. And very much we do that in the context of now ATOM, which is the oncology organization, bringing all these stakeholders together, as well as for diabetes, we are doing that very much with the NCD Coalition for Access to NCD Medicines, which is coordinated by PATH. These are two organizations we are working very closely together with, and we also try to see, okay, what are then the focus countries to bring a full portfolio of oncology and diabetes medicines into the country based on a good quantification and forecasting, which is also one of the challenges still. And how can we link in there to local supply chains and local organizations working with the same purpose and the same aim as we try to bridge that global supply base to the local need, but also taking more and more, of course, local production in consideration. And what we have done over the last year is we have built a platform. We have put together a total oncology portfolio with around 100 products from different manufacturers. And what we are doing now is we are at the stage that the platform is ready. We are introducing that first with the value for the manufacturers. What's the value for you to participate? And in the coming months, we will introduce that to a selected number of countries in the context of ATOM, plus a number of other countries where we work independently also. So oncology is the first one. Not easy, but we have now products which are matching the different regimens in oncology. And the second one will be diabetes, followed next year by hypertension and cardiovascular diseases. So that we said, let's work on that NCD challenge which is there, and not being deviated on our side with all those other hundreds of medicines which might also be needed. But that's where we come in with our wholesale activities, which are having distributors in many countries. And I recognize very much what you said, Gifty, about markups and about quality medicines. But that's also where I hope that the IDA history comes a little bit in place. We have a history of only supplying quality medicines, also having our own quality assurance and quality control in place. And we don't go for the lowest price always. We know that from ourselves, but we know also that buyers are very often looking for lowest price. And there we hope that with a digital platform, we also create transparency from the manufacturer till the point that we deliver the medicines, because internet is only about transparency. And I always say, I hope that at a certain moment, patients with their mobile phones actually shame and blame those who sell at too expensive prices, because they know basically what the prices should be ex-pharmacy. So that's a little bit the background to the internet developments and also the digital platform developments in terms of access for medicines, that also the patients get more awareness what should be prices at the end, and that everybody helps to that goal of bringing the medicines to the patient at the end of the supply chain. But that we also know that there are no, what I would say, intolerable markups in that sense. And the medicines should be variable quality approved. Yeah, and what I only can say to this, we have an expertise on digital together with our partner Solvos. Solvos already has a platform in the market for NGOs, where NGOs are allowed to do purchases for a wide range of NGO products. So we built on that digital experience, and the pooled procurement mechanism has, of course, showed over the past years that it delivers a better pricing for patients at the end. But we are certainly looking for partnerships and closer cooperation with local partners to make this all happening, where we will play that role of bringing international medicines quality controlled and affordable in country, and worked closely with MOHs and drug supply organizations in the country. That's how we are currently developing. So that's a bit of an description of what we are at IDA at the moment, and more to be followed.
Thank you, Harm. Very, very important work, especially increasing the focus towards non-communicable diseases, since, as we all know, non-communicable diseases such as different types of cancer, diabetes are becoming more of a burden for many low and middle income countries that needs to be managed as soon as possible. So thank you for that initiative. We're all very much looking forward to see how it plays out and how it can day-to-day increase accessibility for people to these very needed treatments. Talking about the role of partnerships that you just mentioned as well, Harm, and I think this is very important because we see all of these initiatives that we're talking about today being rolled out with the help of other stakeholders, with the collaborations and with the persistent work to reach out all of these different actors in order for us to work together. Stephanie, could you talk us through a bit more in detail with your experience with the private sector membership platform? How is the platform helping facilitate these collaboration opportunities between different stakeholders, including the industry within Nigeria, but also with the government?
Okay, thank you. So I think a key part of what we do in the platform is, besides creating that sort of network of private sector companies, is also, like I said, bridging the gap between government and private sector, being the middleman to sort of smooth things over. And I think it's always important, being the middleman can be quite tricky because, you sort of have to make sure that both parties' needs are met to an extent, while still sort of playing within the tenets of the agreement. Because, obviously sometimes you can have, unrealistic expectations, which obviously you also as a middleman have to figure out how to manage. And so really, I would say besides the brokering part as well, we also do quite a lot of work with the organizations within the platform. And they range from, I mean, we don't only have local manufacturers, we also have some wholesalers on the platform as well now, given if you understand the Nigerian health system, local manufacturers only manufacture about 30% of the essential medicines needs. And so even with collaborations with the government, there's still a gap in terms of some commodities are still not available with the partnership with local manufacturers. And so wholesalers have a significant role to play as well in that partnership. So we have wholesalers on the platform. We also have quite a number of digital solution providers as well on the platform. You know, like the example would be there's a company that's into track and trace that has recently been accredited to sort of provide that service to the local manufacturers, as Nigeria is now part of the plan for the next, I think, year or two, is to begin to insist that all local manufactured commodities must have a barcode. So that's as simple as that sounds. And that's still something that we are still sort of dealing with now. And you know, as you can imagine, the cost implications of that to the local manufacturer as well is still sort of a touchy area. And so we do quite a lot of work as well in terms of engaging with the ecosystem or the network to try and also get them up to speed with what's going on outside of them and how the rest of the world is moving forward, whether technology-wise or whether even in supply chain. I think we assume that because the company is in the private sector, they know a lot about supply chain. Many times they don't. Their focus is really more on sales than actual supply chain. And so we do a lot of capacity building as well for them in terms of helping them understand the role of supply chain in their businesses as well as how supply chain also feeds into your partnership with the government. Because if you're working with a government that has a plan to potentially maybe supply 300 facilities and they currently supply 100, how does that impact on your supply chain in your local company? How does that affect your forecasting? How does that affect how much you need to manufacture this year now to be able to meet the demand? And helping them sort of understand that, as well as introducing them to some of the other sort of health tech sort of players in the space and how those solutions can also help build their systems as well and help them have, more robust supply chains. We're also doing some work with them around, so how do you increase volume? Because you're doing business with government, and government is all about volume. Like I said, I mean, you have states that have 1,000+ facilities, and are looking for 1,000+ SKUs, and your company only has 10 SKUs. But even the 10 SKUs you have, are you even manufacturing enough based on the demand that the government is asking for? So we're starting to do some work around how do we help them gain access to whether it's financial resources or credit facilities to be able to expand, even within the SKUs you have. Can you ensure that you actually have enough volume? Then the other leg of that is how can you then even expand your SKUs? Like, can you start to manufacture new lines? And what does that mean for you as a local company? And what's the cost implication? And what's the market analysis saying? And is it a valuable area to go into? I know there's been a lot of talk recently around contraceptives, and because currently in Nigeria, I think there's probably little to no locally manufactured, sort of contraceptives. I think maybe besides condoms. So there's still quite a sort of massive space there that is basically being, managed by wholesalers. Most of the contraceptives have been imported. So is there a role for local manufacturing of contraceptives? Is there a role for local manufacturing of vaccines? So we're starting to have those conversations as well with the local manufacturers to say, how do you expand your scope and how do you begin to address some of these issues if we're looking at medicine security? Just to touch on something really quickly. Currently in Nigeria, because of this gap, we're currently having like a massive hike in price of commodities, of medicines. You have some GSK type or some, branded commodities, selling for almost, 100 times or 1,000 times the original price because of the issue with Forex and importation. And obviously some of it is also just people just generally hoarding commodities so that they can charge higher. And so you can see how, because we don't manufacture some of those commodities locally, we're suffering for it now. Those who actually need the medicines cannot afford to get the medicines anymore because, I mean, if something was 2,000 naira before and like you're now having to pay 20,000, what are the chances you can afford that? So that's it's an urgent need, but unfortunately the local manufacturers cannot, rise to the task immediately. But if we at least start that journey now, hopefully, we don't end up in this sort of situation in the future. Thank you.
Thank you, Stephanie, for this. I saw you nodding a lot, Harm. I want to immediately get your reactions here, especially to the part of kind of mapping the need where it is. I know IDA has expertise with this, kind of trying to meet this need, and how do you work with other stakeholders to then make it possible that that people are getting the products that they're needing in time.
Yeah, the struggle is always about balancing demand versus supply and also building the portfolio. And most frustrating is that you have a demand and you don't have the supply and you don't have the portfolio. And that's one reason why I started nodding when Stephanie told her story, because I recognize so many of these things, and especially the government playing a role as well in this is one of the context elements in Nigeria, where some of the products cannot be imported anymore because the government wants to favor local production. Very logical and very explainable, but you need to play also as a government your role in the right way in those contexts. For what we have started now on the NCD Connect platform is we started to secure supply, make sure that we have a complete portfolio. So that is all based on market research, trying to get the data as much as possible. So we tend to say we know what are the types of cancer in the different countries. With the data we got, we know a little bit what the demand of the products is, what our top 20 to 40 important products are. And simply, we looked at the EMLs per country, and we started matching that need and those characteristics with the portfolio we can offer and also the agreements we have then with the suppliers in place. Only having done all that homework, we said, okay, now we are ready to start with NCD Connect. And our NCD Connect platform is not a web shop. It does not list brands. It does not list prices. It gives generic descriptions of medicines. And it's a customer managed portal, a customer managed platform where the customer says, these are the EMLs of my country. This is the need I have. So they can actually set the catalog in the platform according to their wishes. So we offer just this generic range of 100 SKUs, and they can say, no, for us only 30 relevant, and they can put that in the catalog. And then what we call the administrative buyer, the person who is responsible for the catalog, can delegate buying also to districts or regions or health centers, and they can all create their own baskets. And at a certain time in the month, merge those baskets to one request for a quotation. That's how the platform works, but it's all based on customer managed platform so that we try to solve this puzzle of demand versus supply, but also support a more regular ordering in our direction, because we need to solve these issues also with the suppliers. But I don't have a silver bullet on this. It will remain a challenge for the coming years, as long as we don't have the backup data from, let's say, the points of care throughout the supply chain with the demand and the forecasting in place. And that's, yeah, everybody knows that puzzle. It's a difficult game, especially in NCDs for the infectious diseases, HIV/AIDS, malaria, and also TB. That has become easier over the recent years, but NCDs is really still suffering from a lack of a lot of data. So that's a bit of my comment to also what Stephanie told, but also what is waiting for us still in terms of data collection and building knowledge. And hopefully artificial intelligence is going to play somewhere a role in this whole game, but the solution is not there yet.
Exactly. See, yeah, no, not there yet. But hopefully these initiatives are going to help us build this visibility towards the forecasting that we need. And I want to get your thoughts here, Gifty. I know the initiative of Med for All and PharmAccess Ghana work overall. has the advantage of being put in place in partnership with CHAC, with the Christian Health Association, which manages healthcare centers. How has this partnership and the role of CHAC helped get this visibility?
Yeah, so partnership has been very key in what we do. Already said that CHAC takes care of over 30% of the population. CHAC has about 300 facilities, and through these 300 facilities, we desire to impact about 11 million people. However, we do need the data, and the data comes from CHAC. What are the disease conditions that people access healthcare for the most? What is the age range of people that access healthcare the most? And we have done this in partnership with CHAC and also the National Health Insurance Authority, the NHIA, that is the payer, because about 60% of Ghanaians really are insured. And the insurance takes care of up to 90% of health conditions. So we did an analysis of data for a period of 5 years to see what the largest cost drivers of healthcare are, and realized that next to antenatal care and delivery, which is at the top, NCDs, for example, are the second largest cost drivers. So our focus for some time was on NCD medicines. And in doing this, we're collaborating with CHAC, the NHIA, and PharmAccess NCD care program. There's a remote platform for NCD care. So we also focus on, for instance, making sure that we stock NCD medicines at all times. And the same data analytics, for example, revealed that some childhood cancers are not covered by the insurance. So based on that, we came up with a policy brief and we advocated for childhood cancers to be included in the NHIA package, and also for family planning, which was also another critical area to be included. And this partnership with the stakeholders is a very active one. We actually do pay monitoring visits to the facilities, no matter how remote they are. We have visited each and every one of them. And that is where sometimes you hear the patient stories and you see how real the impact of your work is. When a patient tells you, oh, wow, since Med4All was introduced to this hospital, when we come here, we get the medicines. Formerly, we come and we are sent away without the medicines. Now, not only do we get them, but we get medicines that work. When I take this medicine for my headache, it actually works. Formerly, it was, a struggle. And these are some real issues because in the past, there have been issues of substandard oxytocin, for instance, which is used on women after delivery and the uterus never contracts and they are bleeding and it's a complication and all of that. So it's really good that through these partnerships, we are able to see the impacts we desire. And with digitalization, just as Ham mentioned, we even hope to go further. I mean, using AI tools, using our data to see where we can focus our energies and our impacts will be realized the most. So the partnerships have been great, and I really see it as the way to go. And also, let me touch on the issue of funding, because we realized that funding was a challenge for most facilities. How do we fund these medicines? And part of what Med4All offers is a revolving fund, such that when suppliers deliver to the health facilities, these suppliers are paid within 30 days. And that is a big motivation. And of course, it makes a lot of business sense to them because in Ghana, we've had struggles with inflation, over the past year, the cedi very unstable against the dollar. So suppliers then want to be paid within the shortest possible time so that they can sustain their businesses. And going forward, we are also trying to establish a collaboration with the Medical Credit Fund, which I mentioned is one of our programs, so that all healthcare providers can have access to digital loans to be able to finance medicines, so that availability will be ensured at all times for affordable medicines to patients. So this is how, partnership and collaboration is helping to make this possible.
Wow, many topics there that actually make me very hopeful about this evolving landscape. We see a lot of these initiatives already happening and really changing the lives of people who are facing these different conditions. Unfortunately, we're running out of time, so I just want to make a quick round I think we've heard a lot of things that can make us hopeful and can give us a bit of direction into what things need to happen next. But I just want to ask each of you quickly, when thinking about we need to improve availability of essential medicines, what should we do next? What is your number one thing? Maybe we can start with Stephanie, then go to Gifty, and then finish with Harm.
Thank you. I think for me, I've been listening intently, and a lot of what the other speakers have spoken about are, really the challenges we have here as well in Nigeria. So I've been sort of nodding and responding and the likes. And I think one thing that sort of stuck out was that there's so many innovations going on in the ecosystem, and a lot of us are working sort of in isolation. And so there's still that role of partnerships, even within, us, the partners, whether we want to call ourselves implementing partners or, wholesalers or whatever word we want to call ourselves, technical support, whatever the title is, I think we still struggle even between ourselves to create those partnerships. And because I see so many linkages between the work that everyone, the three of us are doing, and how that could potentially be, built upon by just partnering, with each other and potentially other people that are outside of this, conversation, and so that's something that we are always keen on, finding new partners, people who have, innovative ideas that we think can help address the issue in Nigeria. Like I said, we are a resource platform, so whatever resources are available out there that can help to improve the system in Nigeria, we're up for partnering, and so that was the key sort of word that came out to me. We need to partner more. Forget, just even outside of government and private sector. What about private to private partnership? Like, how well are we doing on that space, And maybe that's my sort of call to those listening and to those of us on in this call right now is, how do we start, right after this conversation, how do we start partnering within ourselves to improve the health system? Because ultimately that's what it's about. How do we ensure that people in the rural communities, in the hard to reach areas, wherever you're located in your country, you can access the medicine that you need when you need it, and at a reasonable price that you can afford. So I'll end it on that. Thank you.
Thank you, Stephanie. Very nicely said. And indeed, digitalization has revolutionized many other industries in the world. It's great to see that healthcare is catching up now with so many initiatives. And I would say that collaboration is very important in partnership, just as Stephanie has said. So digitalization, collaboration, partnership is the way to go.
And adding to that, I just want to, thanks Stephanie, Gifty, but also Natalia. I really would look forward if we could have an ongoing conversation on how we could partner. That's the call for action from my side, and I will reach out to Stephanie and Gifty on that, because I thought your examples were wonderful and very, encouraging and also complementary to a certain end. And for the rest, I think my call to action is basically that we onboard digital solutions more, that we give chances to startups in those areas, and especially young people, and empower young people, which are heading very often these digital initiatives. And hopefully we empower them to such an extent that they actually can support what I call the paper and pencil generation, which is still there, and sometimes the decision-making generation. So I think I really would look forward that we empower young startups, people who are familiar, who grow up in the digital age, and basically will make the change in a lot of things we need in the public health area for universal health coverage and system strengthening. So that's my call to action.
Thank you. Thank you very much. So to conclude, I will say more collaboration, more digitalization, embrace the future, but don't forget the past. And thank you to the three of you for joining me today in this conversation. And thank you for all those who have been listening.